I rise in opposition to the amendment and in defense of our nation's seniors who are really under attack. And why is that? Because the current Republican budget proposal passed by this House and up for Senate consideration pulls the rug out from underneath our seniors. It ends Medicare by making huge cuts in benefits and putting insurance companies in charge of our seniors' health care, letting insurers decide what treatment and what tests our seniors will receive. Under the Republican plan, Medicare will end. It will not only impact our seniors, but it will impact the family members of our seniors who will now have those responsibilities. It will reopen the donut hole, making it more expensive for our seniors to get their prescriptions, the prescriptions they need to keep them healthy. And under their plan, they will slash support for seniors in nursing homes while continuing to give subsidies in the billions of dollars to big oil companies. And what else? More than 170,000 Rhode Islanders in my home state rely on Medicare, and they will literally be paying to give additional tax breaks to the wealthiest Americans in our country. To make matters worse, the nonpartisan Congressional Budget Office determined that this budget actually adds $8 trillion to the national debt over the next decade because its cuts in spending are outpaced by the gigantic tax cuts for the richest Americans. Our seniors cannot afford this Republican budget. It would deny them health care, long-term care, and the benefits that they've earned. The Republicans' choice to end Medicare by cutting benefits and turning power over to the insurance company for the important health care decisions of our seniors will result in reduced coverage and exposure to greater financial risk for Medicare recipients, costing seniors an estimated $6,000 more each year for their care. The Congressional Budget Office determined that under this Republican budget, seniors' out-of-pocket expenses for health care would more than double and could almost triple. They concluded, and I quote, most elderly people would pay more for their health care under the Republican plan than they would pay under the current Medicare system. To put that into context, the CBO found that in 2030, seniors would pay 68% of premiums and out-of-pocket costs under the Republican plan, compared to only 25% under current law. And it found that the Republican plan means seniors will pay more for their prescription drugs because it reopens the donut hole, costing each of the 4 million seniors who fall into that coverage gap up to $9,300 by 2020. And the conservative Wall Street Journal concluded that this plan, and I quote, would essentially end Medicare, which now pays for 48 million elderly and disabled Americans, as a program that directly pays those bills. Under the guise of deficit reduction, this Republican plan is recklessly attacking vital support systems for our seniors. We all agree that we have to address the deficit. The issue isn't whether we should do it, but how we do it. Let's repeal subsidies to big oil. Let's eliminate fraud and waste. Let's end the wars that are costing us more than $2 billion a week. But we should not be balancing the budget on the back of our nation's seniors. Our federal budget is more than just about dollars and cents. It's a statement of our values and our priorities as a country. The Republican budget reflects the wrong priorities. They would rather cut benefits to our seniors than cut subsidies to big oil or corporations that ship our jobs overseas. This Republican budget, by ending Medicare, breaks the promise we made to our seniors to protect them in their golden years. We must do better for our seniors. Medicare has met the health care needs of seniors while providing them with financial stability for more than 40 years. Ending Medicare would pull the rug out from underneath the feet of our seniors during their golden years. And I ask my colleagues, if we can't protect our greatest generation, what's next?